My story goes back 2 years from where I am today, where my shoulder started giving me trouble, and over the months it started stiffening up and wouldn't move to the extent that I needed help with someone to help me wear my clothes or to even carry things for me. I couldn't open cabinets overhead. I couldn't do much of the stuff to the extent that people would prod me to use my left hand. It wouldn't move, and everyone kept saying, this is frozen shoulder, gets well on its own in like 5 months, 6 months, sometimes in a year. And I thought this, and some massages and whatnot and painkillers. I even took a cortisol injection shot, did rigorous physiotherapy and said we should review it after 5 weeks, but it became even more difficult. And that's when I started looking for the best treatment, because I was really not wanting to live with this pain. I wanted really the best for myself now, and I actually searched for the best doctor, and I found Dr. Raman Kant. We came to Medanta actually to show my husband for an endocrinology issue that he was dealing with, and the team of doctors here suggested I see Dr. Raman Kant.
So when she came to me, after the proper investigations and examinations, I found out that she is suffering from a very, very stiff frozen shoulder, which has not improved in last 2 years. So she asked me, Doc, can you give me a painless and free shoulder ASAP? I said, yes, there is an option of doing an arthroscopic surgery in those cases of frozen shoulder which do not improve in 2 years. So she was immediately ready at the prospect. We did her arthroscopic capsular release, where we make 2 tiny holes into the shoulder, which are less than 1 centimeter each, and the surgery was completed within 30 minutes, and we could achieve the full range of movements. But having achieved 70 to 80% range of movement on day 1 after the surgery, whereas she was not able to lift around for 2 years, was a great relief to her, and she was pretty happy, and so are we.
To be very honest with you, when I seen the team work the way they were working, I was very sure I didn't have many questions, but still there are those questions that a patient asks. When will I get well? What will it be? What's the surgery going to be? And all of that, and every single question was answered to our satisfaction. And my other experience, which actually touched me, was when I was taken to the OT. I already saw this entire team ready there to greet me, which means that they should have been there at least an hour before I showed up there. That must have been really early in the morning, because I knew I was taken up first in the morning. That goes to show the kind of commitment the team has towards patient care. This is me 24 hours after the surgery. Unbelievable in my own estimate of things, because I hoped it would take me a couple more days to even be where I am today. But I must tell you, I'm able to lift my hand up, roll it almost back, and thanks to Dr. Raman Kant and his team for this amazing, amazing outcome of a surgery. Just 24 hours into it, I feel amazing. Yeah, thank you.